Leading local today in our top story, a measles outbreak in western North Dakota is growing, and what is most concerning is how it's spreading. 9 cases have now been confirmed in Williams County, and health officials say none of the newest patients had known contact with earlier ones. KX News' Kiona Swift tells us more about what's happening, who may be at risk, and what is being done to stop it.
The measles is a contagious viral illness. A lot of people know it for its rash, but it's more than just a mild rash.
In a state that hadn't seen measles for over a decade, there are now 9 confirmed cases, all of them in just one North Dakota county.
It can cause severe complications, including pneumonia, encephalitis, which is kind of a swelling of the brain. About 1 in 5 individuals will have to be hospitalized. And we've had 3 deaths so far reported in the United States this year due to measles.
The most recent 5 patients all had no contact with each other, and the last time measles showed up in North Dakota was in 2011.
Prior to that, it was 1987. So, yeah, it's not something that happens very often.
This outbreak is currently affecting only children and young adults. None of the 9 people had been vaccinated. But this has triggered a surge in demand for the MMR vaccine. Extra doses have been shipped over to Williams County. And anyone exposed who hadn't had the vaccine may be requested to quarantine for 21 days.
Because that's the longest it could potentially take for someone who was exposed to measles to develop the illness. If you've already had measles, you won't get it again. And that's why generally people who were born before 1957 do not need to be vaccinated against measles because they very likely had measles as a child.
Health officials are urging people to check their records and to get their facts only from trusted sources.
We want to make sure people are getting their medical information, including immunization information, from a healthcare provider and not social media or the internet.
Kiona Swift for KX News.
If you're not sure whether you or your child is protected, you can contact your doctor or the local health department. More information, clinic times, and outbreak updates, you can find those at hhs.nd.gov.